So at the ENT Institute, we not only treat voice disorders, but also patients with swallowing disorders. So Nicole, what is a swallowing disorder?
Well, difficulty swallowing, also known as dysphagia, is when a person takes a little bit extra time or effort to get the food from their mouth to their stomach. So this could include taking a lot of time to chew their food, having to swallow several times in order to clear their mouth, possibly even coughing while drinking or swallowing food. It could also result in having a lump in their throat or all the way down into their chest.
Okay, so what can cause a swallowing issue?
Well, several conditions can lead to swallowing problems, including a neurological event such as a stroke or a head injury, recent surgery with intubation, difficulty with respiration or breathing and coordinating that with the swallow, as well as cancer or degenerative diseases such as multiple sclerosis or ALS, even dementia. And acid reflux actually can cause some difficulty swallowing.
So how would a speech pathologist evaluate a swallowing disorder?
So in order to evaluate a swallowing disorder, we start with an oral motor examination to look at all of the structures, and then we move on to an instrumental or objective assessment known as a FAQs. This is where a small flexible camera known as an endoscope with a little light on the end is inserted into the patient's nose so we can look down into the throat while a patient eats and drinks various foods and liquids. So this will give the speech therapist an opportunity to see exactly what is happening while the patient eats and drinks and to determine if there is any difficulties and how we can best rehabilitate those deficits.
So how could a speech pathologist help with the swallowing issues?
Well, following the FAQs examination, I will go back and review the recorded video, and I can determine exactly what is causing the problems with swallowing. I may give the patient some suggestions, such as strategies, maybe to tuck their chin while they swallow or look to one side or the other, maybe take smaller bites or sips, maybe use a straw or not use a straw. We can also begin an exercise program, as well as, in some cases, may suggest modifying food and liquids. So sometimes we might ask to thicken the liquid or even soften the foods.
And what else does swallowing therapy include?
Well, in addition to extensive education on strategies, we also will really focus on the best exercises to target specific muscle groups to help strengthen the swallow muscles. So very much like physical therapy, we'll have patients walk and lift weights. We want to exercise that swallow by swallowing and swallowing and swallowing some more. Yeah. And this is all just to help a patient achieve and maintain the most efficient swallow for improved hydration and nutrition.
Yeah. Come see us at the ENT Institute for your voice and swallowing needs.
And let our family take care of yours.